Hi, I'm Dr. Scott Silverstein from the Centers for Advanced Orthopedics, and I'm here to talk to you about what is a knee replacement. Basically, in knee arthritis, the normal bone and cartilage is eroded away, almost like a bad tire. In this case, you can see the rough erosions where the nice white smooth cartilage is now gone. In end-stage cases, knee replacement can be appropriate, but people always think that we remove a large section of bone. This is not the case. It's more fancy carpentry work, removing small amounts of bone, leaving your own ligaments intact, and this space that we create then receives the knee replacement with a metal cap going on the femur, a plate going into the tibia, and then between the two sides, a plastic liner called a polyethylene. It's almost like the new meniscus, and that's what wears out over a long period of time. But you see, we remove as little bone as possible during the surgery. We hope that these last 20 years. Some don't. Some might last longer. In revision cases, sometimes the entire knee has to be revised, but sometimes just the plastic can be changed. I'm happy to talk to you more about knee replacements. Just call our office at 410-644-1880. Same-day appointments are often available. Or you can see us online at www.mdbonedocs.com. Have a great day.